So this is quadruped. I'm going to talk about alignment real quick, more so at the glenohumeral joint. In the lower quarter, if you have concerns about alignment, go back to the lower quarter, and we talked a lot about cervical spine extension, lumbar spine, hips. Okay, so the position is, let's focus here. Okay, we're focusing at the glenohumeral joint, and we want them kind of in like a neutral position. Okay, so if the glenohumeral joint is abducted, which maybe, can I have you face Courtney? So if he's facing this way, you're going to see if he's excessively abducted at the shoulders, that's going to tell us that the deltoid is probably going to be dominant or short, which is going to pull him into abduction versus kind of a nice drop down. And you can see his deltoids are probably a little bit short or dominant at this point because he is a little bit abducted. Okay? It's not the end of the world. But if we come and look at his scapula, go ahead and face the way you were when you started. So again, the scapula we want about 3 inches away. I don't know how well you can see that from there, but we've talked about it multiple times. But we want 3 inches away is normal. If it's more than 3 inches, then we're thinking that the rhomboids aren't doing their job. The serratus anterior muscle could be short, bringing them into more abduction. Upper traps, if he's really elevated and upwardly rotated, upper traps are probably involved. So these are just some things we want to make note of. Is one of his levator scapula more prominent than the other? Looks pretty good, maybe the right side a little bit. But that's all the symmetry we're looking at. Again, just like in standing, just now he's putting weight through his hands. So we'll go into the movement assessment now, and we'll go through kind of what's happening. So again, this is kind of a review of what we've already gone over, however it's closed chain. So if he brings his heels towards his buttocks, his shoulders should flex. When his shoulders flex, his scapula should abduct, right, and should upwardly rotate. That's normal, just like we've talked about with flexion and abduction. Remember, his lats are already tight, so this position might be kind of hard, and you can kind of see the lats stick out here. But we knew they were tight from the other tests that we've done. So go ahead and come back up. Let's go ahead and do that a couple times. Again, in this position, he's already abducted and upwardly rotated, which is showing us, go ahead and come back up. If you're already abducted and upwardly rotated, again, upper traps could be short. Serratus anterior is a big one, that would be short. So when he goes back, you don't see a ton of movement here because he's already abducted. Okay, so again, we're looking for that mid-axillary line. What's his curve look like? Is there any pain? But again, those are some things that I'm trying to gather throughout this position. So now we're going to rocking forward, and this one's always a little bit awkward, but essentially it's kind of like the end of a press-up. So Courtney's going to try to get the angle so you can see what his scapula are doing. And so as his hips drop down and he does kind of a press-up here, we're looking for winging or not. And he doesn't like this. If I remember right, you don't like this position, right? Go ahead and get out of that position. So like press-ups he doesn't really like. I'm not going to have him repeatedly do that. Okay, when he comes down, do you think you could do one more time for me? Okay, so when he does it one more time here, watch his scapula. I don't think his scapula are severely winging. I think his thoracic spine's flat. Go ahead and come back up. So if his thoracic spine is flat, and he drops down, it might look like he's winging, when in reality, it's just the weight going through his arms are causing a space in here. But I think his thoracic spine is probably more flat than a true winging. True winging is the medial border literally lifting off of the thorax. Okay? So something I'm just making note of, thoracic spine's flat. So that's quadruped position.